We will bring people back because of popular demand, because of requests, because of calls we've gotten. And boy, did we get the calls. And did Dr. Nickles get the calls? Dr. Daniel Nickles joins us again. Welcome back.
Thank you.
I should say that you have a dental clinic and oral health spa.
Absolutely.
Which I love the way you worded that. To go. You're also, you presented an option for people in the world of dentistry called implants.
Right.
When you were last here.
Sure.
And we were just inundated with calls.
Absolutely.
So I want you to touch on that again.
Implants, over 90% of the population above the age of 18 is missing at least one permanent tooth. And an implant is just a chance for them to, have their, get that tooth back. I mean, nobody wants to walk around missing a tooth.
Right.
And it's been just the best alternative to a bridge or a partial or just nothing at all. Because so many people have, unfortunately, through, fear, have maybe put off going to see the dentist, with a toothache until it becomes so bad that by the time they show up to my office, there's nothing to do but take the tooth out.
And sometimes you shake your head and go, oh, if I'd just seen you sooner.
Absolutely. If you just call me sooner.
So some of that fear probably is because we all think dentists are painful.
Absolutely.
Okay, so there's something called sedation dentistry?
Sedation dentistry. Yeah, sedation dentistry is where anybody who, maybe you have a fear of needles or the smells or, you've had a, past, bad experience,
right.
We give you some medication before you come to the appointment. And it just, really calms you, takes away your anxiety, and you're really relaxed, and you're able to just come in and sit down and, take care of all your, dental appointments. Sometimes we can actually incorporate multiple appointments all into that one appointment, so you actually have everything done in one appointment.
Now, are you asleep for this?
A lot of patients are so relaxed that they actually do go to sleep. But I mean, I'm not actually.
But you're not putting.
I'm not putting you to sleep. It's just,
okay.
It's like, you become so relaxed. You kind of, you've worked hard out in the yard. You sit in the chair and you go to sleep. So, but we can shake you and you wake up and you're good to go.
For what things do you think should people consider maybe doing the sedation dentistry?
Anybody who is having fear, who has pain when they eat, or who had a bad traumatic experience in the past, anything that's keeping you from actually getting the dental work that you actually need. If you just, can't pick that phone up because of the fear and it's keeping you from coming in, this will just take all your anxiety away.
Oh, that sounds good. Now, you're telling us, of course, instances that it would make sense to use it, but a good candidate, I mean, are there particular reasons medically, dentally?
A lot of oral health is really tied into, we know now it's tied into cardiovascular disease.
Right.
Premature low birth weight babies are tied into gum disease.
Yeah.
So anything that's keeping you from actually just coming in to get your dental work done, well, make sure you're a good candidate.
All right.
And it's safe, obviously.
It's extremely safe. I mean, it's probably the safest thing, that we do to get you in there. I've been doing this for almost 20 years, and everybody that I have treated, I've never had one person say they will not do it again. And we have people that we sedate multiply.
There are actually different types, though.
There are different types, yes. I prefer an oral sedation because I find it to be very effective. There is an IV sedation. But, most people's fear of the dentist is the needle.
So don't get that near me either.
So, I mean, I don't want to bring you in to stick a needle in you. So,
right. So that you're kind of answering my question. I was going to ask how it's done. So usually it's just orally medicine?
It's just medication. We always review, do a complete medical history on you. And we choose, certain medications, based on your needs. And you take it about an hour before you get to the office, and then by the time you get to the office, it's starting to have its effect on you.
Well, good. So I guess you need to do a little planning if you.
Absolutely.
That's how that goes.
Sure. And of course, many of you guys again remember when Dr. Nickles was here and he was actually showing those implants. This is the doctor. So if people still have questions from that, or if all of a sudden they go, okay, I've been afraid all these years, maybe I will make that phone call. How do they get in touch with you?
Just give us a call at the office at 244-3211, and I actually have people there now answering the telephone. So, we're there to take care of you.
One more time.
It's 244-3211.
And all the information up there on the screen.
And you've taken all of our excuses away from people not wanting to go to the dentist.
No more excuses.
More easy
we will take good care of you.
I know it has to be an easy, nice, tranquil dentist experience when you have an oral health spa.
Absolutely.
I like the name of that.
Thank you so much, Dr. Nickles.
Thank you.
Appreciate it.
Thank you so much. Well, stay tuned, Dr. Nickles, because we've got some good wine for Friday. We're getting into the weekend a little bit early.
Our teeth. You do lightning, too.
Absolutely.
We're going to have some red wine. We're going to need to come to you, get our teeth clean. But we're going to enjoy some summer wines and tell you how to what to serve if you're planning on having people over this weekend.